you're no longer sleeping as well, if you're having brain fog and you can't focus at work, then I would say that it's probably worth seeking help, because, you know, we as women are often taught just to like put up with stuff. Oh, it's part of being a woman. Oh, the blood test's fine. And the person's like, yeah, I still have the symptoms, so what do you want me to do about it? And basically, if you can't find it on the blood test, the answer is always just take the pill or live with it, or it's part of being a woman. Women who have an irregular smear and have to go for a colposcopy aren't given any pain relief. Because a lot of women say in menopause, you know, oh, I look in the mirror and I don't know who that woman is. And, you know, that's a horrible feeling when you lose your sense of identity physically and mentally and emotionally. So all these things are important. It isn't just vanity, it's part of who you are. You do a blood test and you say, oh, the blood test's fine. And the person's like, yeah, I still have the symptoms. So what do you want me to do about it? And basically, if you can't find it on the blood test, just tell them to leave, basically. And what I found when I started learning about hormones is that hormones, in my opinion, is like the foundation of health. So it can account for so many different symptoms that people experience, non-specific symptoms that cause like a bit of a heart sink for a GP, so things like fatigue or mood issues or aches and pains and headaches and things like that. And generally, you know, as the GP, you'd be like, well, I don't know what's causing this. I don't know what to do. And the more I learned about hormones, I thought, oh, there's a hormone imbalance going on. And that's the issue. So I just became really captivated by it. Prior to that, I thought it was just like menopause and that's it. But hormones can actually affect you at any stage of your life. And the symptoms could be more subtle. But yeah, it's really important to make sure you've got a good basis in that. That's certainly not something I was taught in medical school. So I just found it really interesting and fascinating.
Yeah, for sure. And I think a lot of women listening to this will, you know, will really kind of connect with that, because I know from my own experience, we were talking offline before the show, I had so many hormonal issues and actually they were just sort of pushed to the side. So, you know, it started in my teenage years and I was sort of, you know, just told that the menstrual cycle disruption was a normal part of puberty, which I think, you know, it can be in the early stages, but then having this very heavy bleeding, very extreme, you know, abdominal pain that would, you know, leave me lying there sort of writhing and things like that. Really, the prescription that was given to me was the birth control pill by the
Yeah.
age, even though I didn't need birth control. And I think that's a shame in many respects, because investigation wasn't really done. And when I got to university, I came off birth control for a year and had no periods. But I went to see my mum's gynecologist at the time. And the kind of view taken was, well, we need to worry about your bone density, which I think has since been proven that birth control doesn't help improve bone density. I was promptly re-prescribed it and no investigation done, on the basis that it wasn't really anything to pay attention to until I decided I wanted to have children. And at that time I was, you know, reading law, pursuing my career, so it wasn't relevant. But my own experience really was that the birth control pill doesn't really mask some of the symptoms, but it didn't actually stop a lot of the things happening, because by the time I wanted to have a child, you know, my ovaries were highly polycystic, you know, they were covered in little cysts. And I remember having to have ovarian drilling to actually, which is incredibly painful, to kind of encourage that ovulation. Why do you think the system, I guess, sort of, it appears to let so many women down? Why do you think that is?
Well, I think it's quite multifactorial. I think that things are definitely improving now, but historically, I think women's health has always been slightly marginalized. And certainly when I was doing GP training, and that was like, say, 2010, things have really changed since then. The messaging was very much like, if somebody wants HRT, tell them they're going to get breast cancer, and then if they still want it, that's fine, but just document you told them they were going to get breast cancer.
Seriously?
Yeah, but like things have definitely changed since then. We know that that's been disproven now, but I just feel like you know, there's so many things if you get into it, that, you know, from pregnancy care to postnatal care, just being put on the pill for any old period problem that anyone could have. The answer is always just take the pill, or live with it, or it's part of being a woman, and, you know, you've just got to deal with it. And then up until very recently, it was like impossible to get HRT. And obviously that's changed now dramatically, which is wonderful and really good news. But, you know, there's just so many things like women who have an irregular smear and have to go for a colposcopy, which is an invasive procedure, aren't given any pain relief. And, you know, again, it's just maybe another inequality between men and women sometimes that women experience. Because when men have vasectomies, they're given loads of pain relief. So I just think there's so many things like this, and it takes time to change a system. And I'm not flagging up the NHS or GPs or anyone, because it is a very, especially these days, it's a very hard system to work in. But what I was finding for myself is that it was very hard for me to provide the quality of care I wanted to provide within the system and what was available to me. And that's why I started seeing patients privately for hormone issues. And then that really took off because there was a need for it. But I think obviously if you've got a great GP who's open-minded, or any GPs listening to your podcast, you know, they're working in a hard system, but you know, I think there has to be the onus on the individual, unfortunately, to learn about hormones and do that. So I certainly wasn't taught a huge amount about hormones in my training.